El Paso County Public Health is committed to promoting and protecting population health and environmental quality through disease prevention and community partnerships. El Paso County Public Health serves all residents and visitors of El Paso County.
I'm often asked, what is public health, from community members. I think public health means different things to different people, whether it is overall community health or more person-to-person interactions. For example, we have an immunization clinic where young mothers can bring their children to become immunized against diseases, or it may be people that are interested in making sure that their drinking water is clean. We have an environmental health program that does water testing, for example. But we also have many programs where we really try to work with young women and their young children to make sure that they have the best chance to thrive and be healthy in our community.
El Paso County Public Health is governed by a 9-member volunteer board of health. It approves the agency's policies and budgets.
The Board of Health, we're the overseeing body of the Department of Health. We are appointed by the county commissioners. There are 9 of us that serve on the board at any one time. Direct care is one-on-one. So it's you going to your doctor's office with specific symptoms or for a specific checkup, and the doctor's looking at you as an individual person. Whereas I look at public health as more population-based. So we're looking at a whole group of people, what would be best for a group, such as immunizations or air quality, those kinds of things. I think a lot of people probably don't even know public health is around. The staff are kind of in the background of everyday living. It's when your neighbor's septic system fails or your favorite restaurant has like a food poisoning outbreak, or there's a rabid animal in your neighborhood. Those are the times that public health steps in.
Board of Health Vice President Dr. James Turbush has started an innovative collaboration with Rocky Vista University, providing public health training to future physicians in El Paso County.
I think that's the essence of public health, is that public health practitioners are healthcare providers. It's just that their patient is a group, it's a population, it's either a segment of a population or a locale or some other defining factor which they can focus on to improve health. Public health is taught in residency programs, primarily in family practice and other primary care, but and occasionally in pre-med. But in med school, not so much. And I thought it was terribly important that medical students have the opportunity at least to learn about population health and community medicine.
There are 3 main divisions within El Paso County Public Health. The Environmental Health Division addresses health-related issues ranging from septic systems to wells to body art, child care facilities, and swimming pools.
Environmental health is a branch of public health that's looking at environmental conditions, both human-made and non-human-made, and their impacts on human health, the greater public health. The major programs we have in the Environmental Health Division, our biggest is our retail food safety program. We have over 2,400 licensed retail food establishments. And when we say retail food, that's restaurants, school cafeterias, mobile units, grocery stores, anything that prepares and sells food for human consumption. Our staff are reviewing plan reviews for new and remodeled places. We're doing inspections out in the field. We do educational seminars, both online and in person. The goal here is to prevent foodborne illness in our community. Our other large program is our on-site wastewater treatment system program. We know we have about 30,000 active septic systems in the county. So our role here is making sure all new septic systems are properly designed and properly installed. So we license the installers, we review the plans that are submitted by engineers. We also work with the installers and homeowners on failing systems or systems that need to be repaired, making sure that they're prepared properly. And always making sure that these systems are maintained. The whole purpose of this is to prevent contamination of groundwater, which thus is our drinking water through wells. Another area where environmental health is working in the community is is body art establishments. Those are our tattooing and piercing facilities. All of our tattoo artists must pass an educational bloodborne pathogen class, and our staff conduct routine inspections of the facilities to assure proper sanitation. The goal here with our 62 licensed facilities is to prevent a disease, primarily bloodborne pathogen, for not only the client but the artist as well. Another area of environmental health is within our child care centers. We have about 350 licensed child care facilities in El Paso County. We have environmental health specialists inspecting these routinely to assure safe food handling practices, as well as sanitation practices, that the toys are being properly sanitized, the children are washing hands after using the facilities and before eating food, and other areas. Our goal there is to prevent disease within child care centers. And lastly, another area is public pools and hot tubs. We have over 150 facilities, motels and rec centers and schools where we have public swimming pools or hot tubs. We have staff trained on the chemistry side of water recreation, water quality to assure that these pools and hot tubs are safe to swim in and to prevent waterborne disease. The goal in any of our public health programs is to prevent the transmission of disease. So when we're looking at the environmental conditions, I always tell folks it's the food we eat, the air we breathe, the water we drink, and the places where we play, work, and live. That's environmental health.
When disasters and emergencies strike, public health is ready to respond through the Emergency Preparedness Program. Public health staff plans, prepares, and responds to many types of emergencies in the community. Flu pandemics, measles outbreaks, flash flooding, large-scale wildfires, and more.
In public health emergency preparedness, one of our biggest pieces that we prepare for is the potential for a large-scale outbreak of some sort. And one of our tools for that is to set up and prepare points of dispensing, or what are called pods throughout the community. These are places where the community can come to during some kind of a large-scale event to receive medications or vaccines. The most important role for public health emergency preparedness is really to ensure that we have that readiness across the healthcare continuum.
The Public Health Lab works behind the scenes, testing water samples and conducting disease investigations.
We have a variety of different testing that we perform that are related to public health. We perform water testing, bacteriological and chemical testing for the citizens of El Paso County. El Paso County's public health laboratory is basically 3 laboratories in one. This is a nationwide 24/7 laboratory. We're on call all the time. We have technologists here that are highly skilled to do multiple types of testing, from moderately complex testing to very high complex testing. We will see perhaps 60 WIC patients in a day where we're drawing and testing for hemoglobins. We could get animals coming in that we were having to test for plague and tularemia. We may have an outbreak for tuberculosis. So you never quite know what's going to come through the door.
Clinical Services is a reproductive health program that provides health screenings, pregnancy tests, and counseling for men and women.
These services are for men and women of reproductive age, and also for uninsured, underinsured, and we also accept Medicaid here.
The cost of the service is based on age, income, and family size.
We do same-day and next-day appointments, and we can always get you in within a week.
The Immunization Clinic provides important vaccines to people of all ages, from babies at 6 months of age to adults who are traveling internationally. The Immunization Clinic assists people who have Medicaid, people who have insurance but it doesn't cover vaccines, and those with no insurance.
So here at our immunization clinic, what we do is we do vaccines throughout the lifespan, from birth all the way up till whatever. We also do travel clinic, and at that travel clinic, what we do is we provide information to travelers who are traveling generally internationally, health risks that are in those countries. We do different things like malaria education, anything that's associated with traveling with them. Last but not least, we do nurse consulting. We can be a community resource for the community, obviously. If they have any questions on anything vaccine, we are more than happy to answer those for them.
A critical service to protect the health of the whole community.
The Vital Statistics Office has the responsibility of keeping official records. It is where people in El Paso County go for birth and death certificates.
We sell certified birth and death records for any birth or death in Colorado. We help parents with home birth registration when their children are born outside of a hospital without a tending physician, and we help people who would like to register as their own funeral director. Colorado is a closed record state, so you need to be eligible to receive the record. Parents can receive records, you can receive your own record. Spouses, there are different areas of eligibility. You need to be able to prove relationship or direct and tangible interest in the record. We participate in the 122 cities mortality reporting system with the Centers for Disease Control. Once a week we report on cause of death indicators for pneumonia and influenza, and that gives the CDC a snapshot nationally of disease indicators throughout the country.
Preventing the spread of infectious disease is a critical and primary mission of public health. In El Paso County, the Communicable Disease Program works around the clock to investigate reports from doctors, hospitals, national and state resources, and others in order to identify the presence or threat of contagious diseases in El Paso County and prevent outbreaks.
Communicable disease is a disease that someone can catch from another person or another animal. And there are about 60 communicable diseases in Colorado that are reportable to the state. And they are reportable because either they're rare, such as measles or rubella, or because we need to determine where someone might have gotten it, such as salmonella or campylobacter, in case there's foods that might be contaminated with the disease or other types of exposures. We offer TB skin tests for people who are needing them for school work, that kind of thing. The very most common communicable disease in El Paso County is hospitalized influenza. So if you're sick with influenza and you become hospitalized, that is reportable to us.
Maternal child health programs promote healthy families. In these programs, first-time mothers receive critical information and resources through classes and one-on-one visits with nurses.
Our current maternal child health programs, we have 3. The first one is the Healthcare Program for Children with Special Needs. We call it HCP. Our second program is our ABCD developmental screening program. So the ABCD stands for Assuring Better Childhood Health and Development. And then our third program is our Early Childhood Obesity Prevention Program. Our healthcare program for children with special needs is a case management program. We work with children 0 through 21 years of age, and we provide a nurse-led case management. So we are helping families with information and resources. We are working directly with families to help them get the needed medical services that they need.
Community health educators are also educating the community about healthy eating and exercise for children.
Early childhood obesity prevention is El Paso County's effort to reduce childhood obesity rates within our county. We are specifically focusing on the 0 to 5 population, which would mean we have to impact care providers, parents, any caregivers, grandparents, anybody who supports that age population. 5210 is a very short and sweet acronym for specific messages that were developed, first of all, for youth. So it's to help children and young people remember 5 fruits and vegetables a day, 2 hours or less of recreational screen time, 1 hour or more of physical activity, and then 0 sugary beverages, really drinking more water and low-fat milk. So 5210, very colorful, very easy to remember.
Promoting healthy eating and active living is a key initiative for public health. Programs like the WIC, or Supplemental Nutrition Program for Women, Infants, and Children, provide food assistance and nutritional counseling to keep young families healthy.
I'm a registered dietitian with the WIC department, so I provide high-risk counseling for all the participants here, along with supervise some of the WIC educators. The WIC program is a special supplemental nutrition program. It's for women, infants, and children. So we serve pregnant women, breastfeeding women, postpartum women, infants, and children up to age 5. So we provide nutrition education, healthcare education, and supplemental foods for them. This could be anywhere from gestational diabetes or high maternal weight gain, or an infant that isn't quite growing the way we like them to grow. So a busy day is seeing a lot of clients and working with them as well. Also other things that we can do like issue breast pumps or refer to community programs or the tobacco quit line or other things like that.
Tobacco use is a leading cause of preventable disease. Public Health's Tobacco Education Prevention Program works on education as well as policy changes to reduce the community's overall use of tobacco.
Our program works on community-based policies and programs to reduce initiation of tobacco use by children and youth. We also promote tobacco cessation among youth and adults, and we work to reduce secondhand smoke exposure in the community.
Community health educators connect people with free resources, such as the Quit Line, to help them quit using tobacco.
The Colorado Quit Line is a free telephone-based tobacco cessation program. It's free to Colorado residents. Tobacco users that wish to quit can call and get set up with a quit coach that's qualified to help them. They can also receive free nicotine replacement therapy.
The Nurse-Family Partnership is one of several important collaborations with El Paso County's Department of Human Services. It works with low-income, first-time mothers to help them gain skills and experience to thrive.
Nurse-Family Partnership is a voluntary program that serves first-time low-income moms. It's an evidence-based research program with over 37 years of research. The program goals are to improve pregnancy outcomes, help parents with self-sufficient or economic self-sufficiency, and to improve child and health development. To be eligible for this program, you need to be a first-time mom and then meet our income requirements. Typically, if you're on Medicaid or WIC, then you would qualify for the program. Here in Colorado, we enroll mothers from pregnancy up until they're 30 days postpartum. The role of this program is to empower women, to make them confident in their parenting, and to really focus on positive change.
Strong and Healthy Families supports families by giving mothers job skills to find work and become self-sufficient.
People that are eligible for Strong and Healthy Families are women that are pregnant or women that have children under the age of 5 that are receiving temporary assistance for needy families. The most important roles of Strong and Healthy Families is to provide resources to help families gain employment, to provide education, knowledge on the topic areas, and to have an applicable approach to the health, development, and safety of young children.
Everything's been very helpful. Not only have they helped me learn things here, but they've helped me things outside of here. Like if I needed help with doctor's appointments or where to go to do something or to look for jobs, it's not just about the things in class.
El Paso County Public Health also works to promote health through many community partnerships.
Overall, what we want is a thriving, healthy community. And that means all of our citizens. And I'm so proud of the work that El Paso County Public Health staff and their partners do to make that happen on a daily basis.